podcast is provided for informational and educational purposes only and should not be construed as legal advice. Because every situation is unique, you should consult with a qualified legal professional for advice specific to your circumstances. If you need legal guidance, please reach out to an accredited attorney or contact us to schedule a consultation. Hello, and welcome back to the Veteran Benefits Podcast. I'm your host, Rebecca Deming. Today, we are going to be talking about radiculopathy, which is nerve damage caused by back conditions. So whether it's a lumbosacral strain or intervertebral disc syndrome or degenerative disc disease, degenerative arthritis of the lumbar spine, when you have something wrong with your back, your nerves run along your spine. And if those get compressed, it can cause damage. And today I just want to talk about kind of the lower extremity one, but you could have nerve damage that goes down your arms as well. So when your back gets compressed, not every time you can have a back injury without having radiculopathy, but radiculopathy is the medical term that VA uses and that doctors use to describe that nerve damage caused by a back injury. And VA will rate those conditions separately if they're aware of them. So you might get a 10% rating for your back just based on painful range of motion, or 20% if your range of motion is limited because of the back injury. So it could be even up to a 40 or 50% rating for a low back condition if you have really very severely limited range of motion in your back. But you're kind of limited to that unless you have nerve damage. And when I see people with bad back injuries, I always ask them if they also have nerve pain that runs down their buttocks or their legs, because a lot of times if you do have a bad back injury, people don't even realize that that nerve pain is related or that VA could give it a separate rating for the radiculopathy. And not only can VA give you separate ratings for radiculopathy, it's kind of it can be a hidden landmine if you have severe nerve damage because of your back injury. Now, doesn't mean that it applies to everybody, but if you do have severe nerve damage, you can get a bilateral factor if it runs down both legs. And we've done episodes in the past, and we'll do more in the future on VA math, but you get a slight increase if you have disabilities that impact both your right and left extremities. So if you have nerve damage running down both legs, you'd get a rating for each side, and then you get that slight bump up because you have a bilateral factor applied to your bilateral radiculopathy. Not only can you get bilateral factor applied if you have nerve damage going down both legs, but there are several nerves that run through your spine that can get pinched and damaged from a back injury. And VA will apply a separate rating for each one if you get them diagnosed and if a doctor recognizes that they're related to your back injury. So the most common one, and usually when I'm talking to people who don't have a medical background, I'll ask them if they have sciatica or sciatic pain. That is one of the biggest nerves that runs down your spine and innervates your legs. And so it can feel kind of like a numbness or tingling or kind of shooting pain that goes down your buttocks, down the backs of your thighs. It can cause weakness. It is one of the biggest nerves. If you have complete paralysis of that nerve, so VA rates it based on whether you have complete or incomplete paralysis. Very few people have complete paralysis of any of the nerves just from a bad back, unless you actually have paraplegia or quadriplegia. If you have some sort of actual paralysis, and if you do, then you would know that you have that condition, and VA would most likely rate it pretty easily. But most of the time we're talking about incomplete paralysis of the nerve, not incomplete paralysis of your legs or incomplete paralysis of your feet, but incomplete paralysis of the nerve. So it depends on how much of that nerve is pinched, and then VA rates it based on the symptoms. And once you have incomplete paralysis of each of the nerves or each of your affected nerves, VA rates them whether it's mild, moderate, moderately severe, or severe. And that's all that the schedule says. Is it gives you those levels. Within VA's internal manual, they do sort of break it down to help the raters understand what qualifies as mild incomplete paralysis, what qualifies as moderate or moderately severe or severe incomplete paralysis of a given nerve. Typically, if all you have are pain or tingling, it's going to be considered mild unless you have very severe pain. But usually to get a moderate or moderately severe rating or even a severe rating, VA is looking to see if you have atrophy of the muscles, if you have a foot drop, if you have some sort of measurable symptom that an examiner can actually notice when they're examining you that's caused by that. There are also nerve conductivity tests, and I believe they kind of put sensors on your legs and they run a current and they see how much you're able to feel or your body's able to process with those nerve conductivity tests. So the sciatic nerve is one of the big ones. We also see a lot of veterans with damage to the femoral nerve. So that's the femur, runs along the femur bone. There's the popliteal nerve and the tibial nerve. And so as lawyers, we're not medical professionals. We read a lot of medical records, but we're not the medical professionals to sit there and diagnose which nerves are impacted. A lot of it's going to depend on which segments of your spine are impacted by your back injury. And a lot of it's going to depend on where you're feeling those sensations. So if you've got drop foot, if you have numbness that goes down to your toes, that's probably a different nerve than if it mostly just stays in your thighs, if it's your inner thighs. Do you have numbness to touch, or, are you tripping over things? Do you get flare-ups where it's severe pain or tingling? All of those symptoms are going to help the C&P examiner record what's wrong with your back. You may also want to go see a neurologist at VA or a private doctor, or describe your symptoms to someone other than the C&P examiner. One of the reasons we see VA get this wrong a lot is if you file a claim for your back, VA is required to consider all related conditions, everything that's caused from that back injury. But the actual disability benefit questionnaire that they send to the C&P examiners just has kind of a checkbox of, is there nerve damage from, like, yes or no, kind of, is there nerve damage from the back injury? It doesn't break it down by the nerve groups. That's a whole separate disability benefit questionnaire. And a lot of our vets don't even raise that because, they're just focused on their range of motion or the pain in their back. They don't even raise the issue of the nerve damage, numbness, tingling to their examiner. So you want to try to get that in the record. VA has a duty. Once you raise it, VA has to develop it. And so if you're telling your examiner that you're experiencing this numbness, tingling, pain radiating down the backs of your legs, the inside of your legs, down to your feet, wherever it is, they are supposed to be recording that, and VA should send over another request for a C&P exam if they need more information. If VA gets it wrong, we can certainly help you file appeals, getting you in. It might be a chiropractor, it might be a neurologist, it might be your general practitioner, to document the level of nerve damage. So we've seen people go from pretty low ratings to total and permanent based on back injuries with nerve damage, because you could have potentially 3 compensable ratings on each side. So 3 on the right side, 3 on the left side, that get that bump up or that plus up because of the bilateral factor. Plus you have your back rating. So instead of just having 1 rating, you might end up with 7 ratings because of your back and the nerves that are damaged or pinched from that back injury. So sometimes I'll talk to veterans and I'll ask them about nerve pain, and they're like, how did you know? Are you psychic? How did you know that I'm experiencing these symptoms? And I don't know. Not everybody does. But it's common enough that when I see a bad back injury or a bad back disability, I would say more often than not, there's going to be some nerve damage. Now, if it's just muscular, if you just strain the muscles in your back, you may not have nerve damage. And so it's never one size fits all. It's always very specific to what symptoms you're experiencing. But because so many veterans do experience this and aren't aware that VA is required to give them separate ratings for every nerve that's impacted, both right and left side, I see a lot of these conditions get underrated and people aren't pursuing the maximum level of disability that they're entitled to. And it can really be a game changer with the amount of disability pay that you get overall if you get VA to acknowledge the full spectrum of radiculopathy, nerve damage from a back condition. So I hope this information was helpful. Please put comments in the comment section, questions in the comment section. Please like and subscribe, and we will see you next time.